Most amputations are preventable. This episode breaks down what a diabetic foot ulcer is, the early red flags people miss, and the daily habits that protect mobility. Plus, a clear first 48-hour plan if a blister or cut appears. Stay to the end for simple actions you can start today.
Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish Podcast.
Dr. Alyson K. Myers is a professor of medicine and associate chair for faculty mentoring and community engagement at Montefiore Einstein in the Bronx. She leads the system's multidisciplinary diabetic foot ulcer clinic, uniting endocrinology, infectious disease, vascular surgery, podiatry, and behavioral health. Welcome, Dr. Myers.
Thank you for having me.
Such a pleasure having you on. My first question is, what don't you do? No, I'm just kidding.
No, it's a good
Thank
question.
you. Thank you so much for being here, Dr. Myers. First, we just want to get to know you. Could you tell us what inspired your focus on diabetes care and specifically on preventing sort of this lower extremity disease? Where did this come from?
So I feel like diabetes has been a part of my life forever. Even though I personally don't have diabetes, it's been a part of my life due to my family members and friends. So I think my first experience with diabetic foot ulcers, but I didn't really think about it until many years later, was with my aunt. So I used to go to North Carolina every summer to visit my aunt Addie, who had diabetes. She also smoked and had high blood pressure and didn't always have the best diet. She was an amazing cook, so she ate a lot of the typical Southern foods and cooked them really well. And unfortunately, her diabetes was not well controlled. So you have not the best control because of your diet. She was overweight, she smoked, and unfortunately, she developed some of the complications of diabetes. She had pretty bad neuropathy in her feet and poor blood flow, again, from the smoking, and ended up having bilateral TMA. So, in lay people's terms, that's when you lose all of your toes. So, very often it starts with you losing one or two toes, and then eventually things get worse and you end up losing all of the toes. So, pretty much you're left with about half of your foot. And she ended up having it, unfortunately, on both of her feet. And so, I remember being around her and she wouldn't be able to drive for long periods of time because the pain would be really bad. But again, I didn't really make the connection between the diabetes, the smoking, the ulcers. At that time, I was like 14, 15. She unfortunately passed away when I was probably about 21. So it's been a while since she's gone on to her glory. But I think that was my first real experience of seeing the bad side of diabetes when you don't take care of yourself and just how much it can wreak havoc on your lower extremities.
Thank you for sharing that personal story, Dr. Myers. From there, after sort of seeing that and seeing that within a loved family member, help us understand like what drew you to specifically looking at this as a career, right? And like focusing so much on it because the fact of the matter is there is a lot of diabetes out there. The numbers are only increasing. What drew you to this to really make this your career at the end of the day?
So it wasn't initially what I started out doing. I did my residency in a combined training program of internal medicine and psychiatry. So my first area of focus was diabetes and depression. And then over time, maybe about 6, 7 years ago, I started working with a vascular surgeon at my previous job, and she was like, "There's so much that we can do between the overlap of diabetic wounds, as you being an endocrinologist, me being a vascular surgeon." So we actually did a chart review looking at what are some of the variables that are associated with people who are coming to the hospital with a diabetic foot ulcer and having to be readmitted to the hospital. So it wasn't surprising some of the things that we found: people on insulin, because most people who are on insulin have had diabetes for a long time. Usually, insulin is added because their sugar is not the best controlled. Also, we found that people who are on blood thinners, they tended to come back. People who went home and had a home care nurse come out to the house, because obviously a home care nurse is going to be a little bit more diligent about looking for certain signs of infection. And so then when I switched jobs, one of my colleagues in infectious disease reached out to me and said, "Oh, we should do some work together and partner on this." So it just kind of became something that was a passion that I didn't set out to make my passion. But sometimes you find things just when you meet the right people. Sometimes it's just kind of that fate.
And it just brings you to it. For our listeners, can you help us first just help us understand? the work that you do. So, for folks who may not be familiar, what exactly is diabetic foot ulcer and why is it so common and yet also preventable?
Right. So when we talk about common, it's about 10 to 30% of people with diabetes in their entire lifetime will have a diabetic foot ulcer. So usually what happens is that we have a couple of precipitating factors. So one that I mentioned earlier is neuropathy. So lay people's term for neuropathy is when you have damage to the nerves, and you can get one of two things. You can get increased pain, or you can actually get numbness in your feet. So when you don't feel things very well, or you're too sensitive to how you feel things, what can happen is you can step on something and not realize it. You could be wearing improper shoes that are causing rubbing. And usually, what will end up happening is you'll get some sort of breakdown in the skin. It may be something that looks like a blister or a callus. And then, unfortunately, it can go from being just a basic ulcer to being infected. And that's when we have issues. So, the infection can be the result of your shoes are just dirty and you're wearing shoes without socks. It could be a matter of you walking around barefoot. It could be again because you don't feel you step on a nail or a tack and it's rusted. So there's multiple ways that you can develop these, but there's many more ways to prevent them. So you can be a part of that 70 to 90% that doesn't get a diabetic foot ulcer.
That's interesting, and just so we have the relation to diabetes, so we're talking about complications from diabetes that leads to neuropathy to begin with. That in what you feel in neuropathy, where you don't have that feeling on your nerve endings, and that's why when you're stepping on a tack or a nail or something like that, or the shoes like you mentioned, we have no realization of that as well. Okay,
Mhm.
super helpful. Which takes me to my next question. What are some of the earliest signs or symptoms patients should look for to catch such foot problems before they become serious? And are there any red flags that you can talk about here that often get ignored?
Absolutely. So one of the most important things is to check your feet every day. So that's looking at the tops, the bottoms, the cracks between your toes. If you're someone who has mobility issues, you cannot see your feet, you have two other options. You can ask your caregiver to look between your toes and at the tops and the bottoms, or else you can use a mirror. So you can put your foot up to the mirror, put a mirror on the ground and look at your foot on the under surface. You're looking for cracks, you're looking for blisters, you're looking for calluses. It's also important that you keep your feet well hydrated. For those of us who are in the Northeast right now, we're getting killed with these really cold temperatures. So when the air is really dry because you're running all this heat, whether it's from a radiator or a space heater or you have central air, that's going to dry the air out and make your skin very dry. So winter feet tend to be very dry and prone to cracking. Also in the wintertime, because it's cold, we take hotter showers, which is going to pull the moisture out. So the wintertime is a time where we're going to be very susceptible to having dry skin, and that can set us up for ulceration. So we really need to keep an eye on our feet as well as make sure we moisturize. The unfortunate thing is a lot of lotions that are sold here in America are water based, so they're not the strongest when it comes to moisturizing. So you need to use one of the usually more expensive lotions, unfortunately, like a Lubriderm, an Aquaphor, an Aveeno, Gold Bond for diabetics. There's another brand because they tend to be a lot thicker. Some people also will use Vaseline. We often will prescribe ammonium lactate. You can't get that over the counter, but these tend to be thicker creams, so they serve as better barriers for moisture retention in our feet. So I would say check your feet daily and use a good moisturizer. Really important.
Okay, so moisture is key here.
But make sure you're not
Mhm.
putting it between your toes because if you're doing it between your toes and they're too moist, that can set you up for fungal and other types of infections. So I always say the tops and bottoms, not between the toes.
Okay, remember that one. That's helpful. When it comes to daily prevention, what are the most important habits you want every patient with diabetes to develop that's listening here today?
Sure. So it starts with your socks and shoes. So there are special socks that are called diabetic socks. So very often the socks we have that elastic at the top, which can actually cause compression. I saw a patient the other day whose legs were really swollen, and I was like, the socks are making it worse. So make sure you either cut the top off of the socks so the top elastic isn't cutting off your circulation, or you can buy diabetic friendly socks. They sell them most in local drugstores. You can find them online, but that's something that's really important is making sure that you're getting socks that are not going to compromise your circulation. The other thing is making sure you're getting proper fitting shoes. So for those of you who have Medicare, Medicare Part B entitles you to a free pair of diabetic shoes every year, as well as inserts. For a lot of folks, for my community, we're flat-footed, so wearing improper shoes will set you up for all types of bad things that can happen. So very often inserts or just good fitting shoes are really key. And also it's important to let your shoes breathe. So if you wore a pair of shoes today, tomorrow you should wear a different pair. So I tell people you need to give your shoes 24 hours to breathe. Otherwise, they'll just be a nasty, like petri dish full of bacteria and fungi. So you always want to let them just breathe for a good 24 hours or a day before you wear them again. So those are a couple of really important daily things. One other thing I like to add that's not daily, but is also a part of a lot of people's lives, male, both male and female, and that's going to nail salons. Nail salons, sometimes I've had patients tell me, "Oh, the tech told me that they specialize in diabetes." So I always tell people, unless if that tech has gone to podiatry school and has a doctor in podiatric medicine, they are not specialists in foot care. That's not something that a tech is qualified to do. So I always tell people it's really important that your podiatrist, yourself, or a caregiver you trust should be the one that cuts your toenails. The nail salon should not be cutting your toenails. They should not be cutting your cuticles. They can push them back and they can help, file your nails down. But it's really important that you're not letting them cut because what can happen is if their equipment is not clean and they cut the cuticle, you can get an infection if the equipment is dirty. And that's unfortunately a way I've seen people lose their toes. And I even saw one man, for example, because he didn't feel very well, he got put his feet in the tub of water and he did not realize how hot that water was and he ended up with second degree burns. So that's the other thing. So it's cutting of the skin and improper temperatures because again, if you have nerve damage, you may not feel how hot that water is. And he unfortunately not only developed burns, but he also developed an ulcer and ended up losing some of his foot.
Oh goodness, man, that is something. Okay, well, thank you for providing that context and like how we should be thinking about foot care. How much of lower extremity disease is related to blood sugar management in particular versus other factors? You talked about circulation or footwear for that matter.
Yes, so the problem is if your diabetes is not well controlled, can make your neuropathy worse. I've had patients that their, blood sugars, the hemoglobin A1C, we use that every 3 months. For most patients, it should be under 7%. I've had patients, their A1C was running 11, 12, 13. Once it got down to that 6, 7 range, they noticed their neuropathy was not as bad. So there definitely is a correlation between having poorly controlled blood sugars and nerve damage and worsening neuropathic pain. So it's really important that you're controlling your sugars to prevent this from getting worse. It may not permanently go away, but it can potentially get better. Also for circulation purposes. So I mentioned earlier that my aunt was a smoker. Smoking narrows the vessels. It's what we call vasoconstriction. So it makes the vessels smaller. If your diabetes is not well controlled, not only and you're a smoker, not only will you have a small vessel, but your vessels will be sticky because all that extra sugar will sit there. So even if you're a non-smoker, your vessels may not be narrow, but they're going to be sticky. And that's the perfect way of getting some sort of clot. And that's why people with diabetes are at increased risk of having vascular disease or circulatory disease if they're not controlling their diabetes very well.
That's helpful context because this is all like you think blood sugar, but it has implications on so many things. I mean, we're talking nerves, or I mean, there's separately. I mean, not for this episode, but even related to like vision, for instance. There's so many complications of diabetes that folks don't immediately understand or connect the dots on, but it's all related, right? At the end of the day,
And can I connect the dots on the vision? If
please.
you have poor vision, you're not looking at your feet. So it all is going
Mm.
hand in hand. So if you have really blurred vision because you have what we call retinopathy or damage to the vessels that are supplying your retina, you're not going to notice those cracks in your feet. So to your point, it's all coming together, unfortunately.
I mean, they say, just to go on a tangent here, they talk about how diabetes is a silent killer, and that is so true because it's working behind the scenes. It's not showing up in an explicit way. Like if you have a virus, flu, something like that, it's showing up. You're seeing symptoms, and you're feeling the aches and pains and whatever. But this is silent. It is creeping, all through you, from foot to eyes, your kidneys, I mean, all the way through, and it's just the damage is like nicking at all these different body parts. And if you're not on top of it, it can really get bad. But thank you for that perspective,
Absolutely.
uh, Dr. Myers. As we move forward in this podcast, next I want to talk about some of the biggest misconceptions. I'm sure you hear that from patients all day. There are lots of myths and misconceptions around this. From patients or even from caregivers that they have about their diabetic foot health. What do you hear? What do you see?
Yeah, so I mentioned the nail salons, but I think another big part of this is that people think if they have a small little cut or lesion, they can manage it on their own. I remember taking care of a truck driver who had developed a callus, and he thought that he could just pick it on his own, put some benzoyl peroxide on it, and not benzoyl peroxide, I'm sorry, just peroxide, and that would, heal it. And he did it for about a week, and unfortunately, rather than healing it, it made things worse. And he developed a really bad pus pocket underneath the skin that he didn't see, and he unfortunately ended up losing his foot. So what can happen is things like bacitracin, alcohol, peroxide, if we use them, you actually sometimes can make things worse because you're destroying the good bacteria that you need to help heal a wound. So what I always tell people is little things become big things. So rather than trying to do it on your own, whether it's your primary care doctor, your the nurse practitioner you see, the endocrinologist, you should always show things to your doctor. I've had people who are like, oh yeah, I don't think it's a big deal, and I can't even get the sock off because there's a big nasty ulcer sitting there. Or I smell it. I had one patient who came in, he couldn't even put his shoes on because his foot had swollen up so badly. And he walked in wearing four pairs of socks on his bad foot and a shoe on his other foot, and it smelled like a dead animal. And he had gangrene. Thankfully, he didn't have poor circulation and his nerve damage was there, but it wasn't all the way there. So he didn't lose his toe, but he had lost a toe a couple of years ago. So really, the earlier you seek care, the better. That's really the take home. And so many people I've met will be like, I really regret not coming in sooner.
Because by the time it's showing up in that way, it's already getting to be too late. So you can be spent, you can't sort of ignore those signs, especially at that point when it is that obvious. Which takes me to my next question. So we've been talking about, examine your foot, look at signs, look at cuts, look at blisters. Let's say a person listening to this episode today did find something of concern. What is like the immediate thing they should do? What do the next 48 hours, let's say, look like for them?
Right. So the nice thing is we have stages of, what's quasi bad and what's really bad. So the things where you go, like I would say straight to the emergency department, is if you have a fever, because that means the infection is probably throughout your body, systemic. It's not just contained to your foot. If you're seeing pus expressed. So it's normal when you have a wound to have like some clear, maybe slightly bloody fluid. But if it looks like pus where it's pure white, you need to go to the ER. If you notice that it smells really bad, that probably suggests gangrene. Again, I would go straight to the ER. If you have severe pain, I would also say you probably need to go straight to the ER. Where it could be, you might be able to get away with urgent care or going to your doctor is if you have some mild swelling, some mild redness. It may be more superficial in the skin where you can get away with doing antibiotics at home. But those other things where it's suggestive of systemic, so like the fever or chills, increased heart rate, above 100, with severe pain, that's more suggestive of infection in the blood or even into the bone. So that's a little bit more worrisome, in which case you're more likely to need IV antibiotics. The pills won't be efficacious.
So appreciate that. So that's the game plan for, what we find and what we see. And again, go see someone. Do not ignore it. As we wrap up the episode here, Dr. Myers, what challenges are often overlooked when facing the prevention of lower extremity disease, and how can the healthcare system better support them?
Yeah, one of the things we take for granted is the shoes that we wear. And again, Medicare will cover you for diabetic shoes, but if you have commercial insurance or Medicaid, not necessarily so. It's not across the board, it can vary. So I think the unfortunate thing is if you look at the sneakers that are recommended by our podiatric colleagues, they're great. And the issue is they tend to be really expensive. So brands such as like Brooks, New Balance, Hoka, Asics, just to name a few. And I'm not trying to say other brands are not good, but I'm just, those are some of the ones that I think about because again, I have flat feet, and so these are some of the more comfortable sneakers for somebody like me. Um, those tend to be a bit more expensive. They can easily run you well over $100. And for like my patient population in the Bronx, spending $150 on one pair of sneakers is a lot. So I tell people, whether it be looking for the outlet, looking for sales, because people do have sales, it's definitely advantageous. I mean, I bought a pair of one of the brands I just mentioned. I got them on sale from Dick's Sporting Goods, and it was still $110. But for me, $110 is not the same for someone who's living paycheck to paycheck or on a fixed income. The sneakers were originally, I think, $170. And based off of principle, I was like, I'm not paying that much for one pair of shoes. I know they're comfortable, but that's a lot for one pair of shoes in the grand scheme of things. So I think that it's really important that people know the importance of getting good fitting shoes and understand that they can sometimes use their insurance benefits for to defer some of this cost. But it's like my mom always said, the cheapest is the dearest. So if you wear cheap, poor fitting shoes, you're going to be at risk for things like hammer toes, blisters, and that's even if you don't have diabetes. I don't have diabetes, and I have to be really careful about the shoes that I wear because, like I said, I don't have great arch support naturally. But a lot of our patients with diabetes do have foot deformities, whether it's being flat footed, high arches, hammer toes, bunions. So making sure that they're wearing proper footwear is something that we as the providers need to teach people, but even the folks in the shoe stores. They need to do a good job of showing people how to buy the right pairs of shoes, not trying to just make a sale.
Very helpful. And, to our listeners, take this, understand this, and, try to find ways to apply this for yourself because, like, like you said, Dr. Myers, if you have a concern, you have to protect yourself. And ideally, it's a covered benefit for you. So you'll be able to utilize that benefit. With that, Dr. Myers, we are toward the end of the episode. At this point in the episode, I like for you to perhaps tell us how listeners can connect with you, learn more about your work, just learn more about this space.
Yeah, so I have some video content on my Instagram, Dr. Savalim. So it's Dr. period Save Savealimb. It's Dr. Savalim. There's some really good videos where I'm talking about diabetic foot ulcers. Also, I would say another great resource always is like the American Diabetes Association. They have a lot of great work. The APMA, that's my podiatry colleagues. You can look up what type of shoes they highly recommend that are good for use. Again, I just named a few of the brands. And just because I name the brand doesn't mean it's the exact shoe. So each brand will have shoes that they'll recommend depending on what type of foot issues you may have. Some people overprotonate, that's when your foot rolls outward. Some people have the opposite, where their foot rolls inwards. So you have to look and see what is your foot issue, and they'll tell you which type of sneaker they recommend within each brand. So it's not all Hokas, it's not all Brooks, it's not all New Balance, it's not all Nike, it's not all of these. They'll tell you certain ones of Saucony, whatever. So I highly recommend that, and that's for lay people. You don't have to be a physician or a podiatrist to look that up.
Super helpful. Dr. Myers, thank you so much for sharing that and for all the insights that you've provided here today. To our listeners, thank you for listening to another episode of the Yumlish podcast. Head over to our Facebook, our Instagram, which is at Yumlish, and comment below this podcast post to tell us what is one healthy habit you found helpful in managing your diabetes or diabetes for a loved one, or one that you want to start building today for yourself. We're hoping that this episode has inspired you to make some changes again for yourself or a loved one. So head over to again at Yumlish on Facebook, on Instagram, and again tell us what is that one healthy habit you found helpful in managing diabetes for yourself or for a loved one, and and one you want to start building sooner than later. Thank you so much for your presence here, Dr. Myers, and for the insights that you've shared.
Thank you.
Thank you for listening to the Yumlish podcast. Make sure to follow us on social media at Yumlish underscore on Instagram and Twitter, and at Yumlish on Facebook and LinkedIn for tips about managing your diabetes and other chronic conditions, and to chat and connect with us about your journey and perspective. You can also visit our website, yumlish.com, for more recipes, advice, and to get involved with all of the exciting opportunities Yumlish has to offer. If you like this week's show, make sure to subscribe so you can hear more from us every time we post. Thank you again, and we'll see you next time. Remember, your health always comes first. Stay well.